Okay, hello everyone. In this little video, we want to discuss about some case studies related to the biochemistry topic of digestion and absorption of carbohydrates. Okay, so I will be mainly focusing on the case discussion and the following question parts. We will be discussing two cases here. These two cases are actually very much important for your theory exams and your sometimes your biochemistry theory viva also may go into these cases. Okay. Now, starting with clinical cases. The first case, I want to show you this kind of picture, and the clinical scenario will be given like this. That is a 1 year old boy present to the hospital with the complaints of swelling in the abdomen, pain, and diarrhea after taking a milk. Specifically, I want to highlight the milk products and dairy products. These symptoms were existing for past 4 months and started soon after weaning was introduced. Weaning means. Okay, this symptom will be started soon after the weaning was introduced. The weaning means you have to stop the breastfeeding and shifting phase from breastfeeding to the solid foods. Okay, so this symptoms will be started at the time of or after a weaning period was introduced. A baby is totally alright when fruit juice is given. So when you are replacing the milk product to any fruit juices, the symptoms are not appearing. This is also very characteristic point. Okay. On the examination, you will examine the child and the perianal skin will be showing a erythema, which may be due to frequent passage of stool with a low pH. Okay. So first question is what is the reason of perianal erythema? It is because of the low pH stool, and why the low pH stool is happening we will see subsequently. So first question is what is the most probable diagnosis in this particular case. I hope from the case that it is very clear the possible diagnosis will be due to consumption of dairy products. They will precipitate the symptoms according to the history. Okay, while intake of fruit juice the baby is very alright, so this history typically suggesting of boy is suffering from lactose intolerance. Okay, you can see कौन सा sugar होता है milk and milk product में, it is lactose. Okay, so it is a lactose intolerance. I hope the first question is very clear. Now what enzyme deficiency will be causing this? So you should know this is due to lactase deficiency, which is also beta galactosidase enzyme. Okay, the gene of the enzyme lactase is located on the chromosome number 2. Okay, so maximum lactase expression in the intestinal cell occurring in the first month of life, they will be decline after weaning. Okay, so characteristically you can see the history also that for a past 4 months these symptoms was existing and started soon after the weaning was introduced. Okay, deficiency of this enzyme is commonly in a preterm infant. Okay, commonly seen in the preterm infant, and this is the last disaccharide which developed during the intrauterine development. This is also very important. Hence, deficiency of this enzyme is commonly seen in the babies born with prematurity. Okay, the lactase enzyme is often situated in the microvilli of small intestine, especially in the mid jejunum, and it hydrolyzes the dietary lactose into its monomer. What is the monomer of lactose? D-glucose and galactose. They are enzymes of intestinal life. So, in this spans and it homodimer made up of two extracellular and cellular parts as well as so. Okay, so the enzyme has extracellular as well as cellular parts. So, lactase level lactase non-persistence (LNP). LNP affects 70% of world's population and is underlying physiological factor for primary lactose deficiency. What is the primary lactose deficiency? It is a not due to any other condition, but it is due to enzyme deficiency. Okay, so it is called primary lactose intolerance. Okay, due to lactase non-persistence. So while declining in the lactase level starts soon after the birth. The symptoms generally do not mainstay for before the 5 years of ages. Presentation is in a early age group and is most commonly associated with underlying gut conditions like viral gastroenteritis. Sometimes child may have a cow milk allergy. Sometimes there are some infections also like giardiasis, and sometimes it is a celiac or gluten hypersensitivity or celiac disease, or tropical sprue may also present like this kind of symptoms. Okay, now coming to third question, what is the biochemical basis of signs and symptoms in this particular case? So what are the sign and symptom first you are observing? It is a abdominal distension and bloating. So why abdominal distension and bloating occurs? The undigested unabsorbed lactose in the lumen is an osmotically active compound, and it tends to absorb so much amount of fluid resulting in the diarrhea. First of all, I hope this thing is very clear. It also becomes a substrate for the action of intestinal bacteria which ferment the lactose in the colon to what? Short chain fatty acids, hydrogen, carbon dioxides, methane also. So ultimately these gases will causing abdominal distension and the patient may experience a bloating, and these gases are responsible for flatulence and distension abdomen, etc. Okay, so mainly this occurs due to dairy product consumptions. Okay, now next coming to the next question, how to diagnose a case of lactose intolerance in the baby. Okay, so diagnosis, we can see the diagnosis in 3 points. Okay, so first, stool pH, because you can see lactose ultimately they will be combining with a hydrogen ions, so there will be acid formation. Okay, stool pH in infants with lactose intolerance is typically below 5.5 to 6. They will be usually below, and that's why you can see in this patient there is a erythema around the perianal region. Okay, otherwise second thing you can do is measurement of total and reducing sugar in the stool, which is an indirect test for the lactose malabsorption. Third thing is an hydrogen breath test. So what will you do in this test? In this test, exhaled hydrogen is measured. Exhaled hydrogen is measured after giving a standard dose of lactose. So after overnight fasting period, baseline hydrogen should be close to 0 parts per million. Breath samples are taken every 30 minutes for 3 hours from time of lactose bolus. Okay, from the time of lactose bolus, you are taking the breath samples every 30 minutes for 3 hours, and these a rise in exhaled hydrogen by 20 ppm from baseline is considered as a diagnostic tool of lactose intolerance. Don't worry, I will provide the a whole explanation in a particular manner in a written format to you, but here you just focus on whatever I am telling you. Okay, I will be providing the uh, solution of the all the questions. Okay, so don't worry about that. Now coming to the fifth question, what is the dietary advice you will be given to mother? Okay, so mother is advised to give a lactose and galactose free diet for to this baby till the symptoms subsides. What will you do thereafter? Thereafter, once symptoms gets subsided, will you give a lactose again or what? Okay, this is the question. So thereafter what you will do, lactose containing food should be reduced but do not completely eliminate. Okay, breast milk has high content of lactose, that is approximately upon 7.5 gram per 100 ml. So, but it should be continued. Okay, because breastfeeding has another benefits also. So typically, if you are stopping the breastfeeding, the child may land up into the malnutrition. Okay, so you can give, you can give uh, products which has low amount of lactose like skimmed milk, in which 4.8 grams only in per 100 gram content you can. Full milk में it is 4.7, yogurt में fresh yogurt है तो 3 ग्राम पर होता है, बटर मिल्क में भी also 3 ग्राम, चीज में और बटर में भी, बटर में it is very less amount of lactose, nearly 0.5 grams per 100 gram. Okay, right? So next question is, what are the other clinical variants for this disorder? And Is it an adult type of hypolactasia? Yes, adult type of hypolactasia is also seen, and which is typically characterized by down regulation of lactase enzyme activity. Okay, it is not completely absent, it is a down regulated enzyme. Okay, if it is completely absorbed, the symptoms would have manifested at earlier stages or infant stages. Okay, so here what happens, lactose intolerance is generally reversible. Okay, but adult hypolactasia is an irreversible condition. You should remember like this. Okay, अदर क्लिनिकल वेरिएंट में होता है एडल्ट टाइप ऑफ हाइपोलैक्टेसिया इज डाउन रेगुलेशन ऑफ लैक्टेज एंजाइम एक्टिविटी अकॉर्डिंग टू द एडवांसमेंट ऑफ एज. ओके, it is completely irreversible, you cannot do it. So just for the older age people, you should take that, completely avoid the milk and milk products, because sometimes they will experience the these kind of symptoms. Okay, now we'll be coming to second case of our discussion. I hope you can see the case, which is a 5-week old male child, was admitted with a history of diarrhea for past 1 week, irritability and refusal to feed for past 4 days. On careful exploring the history, it becomes evident that baby was exclusively breastfed for 3 weeks, after which he had given a dried milk powder with added sugars to enhance the taste. Added sugar में क्या होता है? Added sugar में it is sucrose and other polysaccharides can also be added. Okay, so many amount of carbohydrates will be added, and so many types of carbohydrate is added in a dried milk powder for taste enhancement. And moment he is giving a milk powder, he is developed a diarrhea along with vomiting. So when dried milk powder was introduced with added sugar, so on examination baby was totally dehydrated because of diarrhea. Because of dehydration it has irritability and was continuous screaming. Abdomen was full and tender. Routine blood investigations CBC ESR was absolutely normal. Bio- Blood biochemistry showed normal result for various parameters. Stool culture was negative for any parasite and bacteria. So it is not at all infection. Baby was admitted and he was treated. Baby had aversion to sweet food. Some symptoms subsided when sucrose was replaced with glucose. He improved and was discharged after 4 days of admission with treatment for dehydration and diet free for sugar. So what is a clinical scenario for this particular case? The answer typically means this baby is having sucrose intolerance. Okay, so in this condition there is a deficiency of sucrase enzyme, just like a lactase in lactose intolerance, which is required to cleave the sucrose into glucose and fructose. Okay, so what explain the biochemical basis of sign and symptoms. So deficiency of enzyme ultimately resulted in a no digestion of sucrose, which is acted upon intestinal bacteria, which convert sucrose into various gases, just like lactose intolerance. These gas in the intestinal lumen will be going to cause bloating, distension, and abdominal pain. And baby slowly learns to avoid the sweet foods. Okay, and develop aversion to the sweet foods. Okay, so how to confirm this particular test? So we have non-invasive test for the sucrose tolerance, and we have 13C sucrose breath hydrogen test also. So sucrose tolerance test is done by giving 2 gram per kg of sucrose as a 20% solution, and we have to estimate the blood glucose, which is done in 30 minutes, 60 minutes, 120 and 180 minutes, comparing with fasting. Okay, so I will be showing you the graphs. Okay, you can see this graph, a sucrose tolerant test. Okay, you have to note the flat curve. Flat curve is seen in the patient suffering for sucrose intolerance along with a watery diarrhea after instituting the test. So you can see the flat graph you can see. Okay, in figure number both A and B. Okay, you can see the flat graph, relatively flat graph, right? So this test is considered normal when there is a rise of at least 20 milligram per deciliter in the glucose level compared to fasting state. Okay, so what is this? 20 milligrams up jana chahiye. Okay, depending on the fasting, but in this particular cases there will be a no 20 milligram of the test. Okay, that 20 milligram is not going to be rising in this particular. Flat curve is seen in sucrose intolerance. Okay, I hope this thing is very clear, right? Okay, so this test is considered normal when there is a rise of 20 milligram in the glucose level compared to fasting state during the test and the absence of diarrhea within 4 hours of the test. Okay, I hope this thing is clear. So what is coming to the fourth question, what is dietary advice you should give to the mother? Sucrose, that is stable sugar free diet, is advised for a lifelong. Okay, sucrase, that is has been shown highly effective, leading to relief of symptoms and improved nutritional status. Baker's yeast, they will contain lyophilized Saccharomyces cerevisiae and has enough amount of sucrase activity, mild isomaltase activity also, but no lactase activity. It can be advised in a sucrose intolerant patient. Hereditary sucrose intolerance in the adults is precipitated by gastroenteritis, is very rarely encountered situation. Okay. What is congenital sucrase isomaltase deficiency, CSID, and what is gold standard? Okay, CSID is a combined sucrase and isomaltase deficiency. It is an autosomal recessive disorder. Standard test for diagnosis of CSID is small intestine biopsy for sucrase and isomaltase activity. So I hope this full clinical discussion is very useful to you. Okay, these two cases may be asked in your examinations. Okay, thank you so much.